we can make sure we have pieces. Hello. Gonna wait a moment as folks get in from the waiting room.
You maybe let us know about the series, what it will look like in the future, or this is a one time.
Oh no, yeah, I'll talk about
Mhm.
where we're going from here.
Thank you.
That's a great question. Yeah, thank you. All right, see, it seems like we're slowing to a slower crawl, although I do know folks continue having these at 3 o'clock in the afternoon Eastern mean that usually for the first 5 minutes or so, we'll have folks pop in as they get from other meetings.
Mhm.
But I will get us progressing forward. So, welcome all. I'm Frank Hood with Hep B United and the Hepatitis B Foundation. This is our every other month Be Informed session. This is technically our March session, even though it is April Fool's. April Fool's, it's our March session. That was just because our last two Tuesdays, HBF had other programming occurring at this time, virtual programming. So we just bumped this a couple of weeks, but this would normally have been 2 weeks ago. So we appreciate you being here today with us instead. Uh, if you have not joined us before, this is a session that's being done in webinar format. We are being recorded. Oop, nope, go back. We are being recorded, and the slides will be put up afterwards, as along with the recording on our hepbunited.org website under capacity building. Um, because we are in webinar format, all of the attendees are on mute. We do, though, ask that attendees introduce themselves in the chat, give us your name, organization, and preferred pronouns. Additionally, as our speakers are talking, we ask that you please put in any of your questions into the Q&A box. That is so we can potentially field some of those questions, live, and that will then, at the end when we move into Q&A, we'll know what questions we can go and kind of just get kicked off with. If there are any questions that we're not able to answer, either because we don't have time or because we just don't know the answer, we do follow up. So if this is your first time with us, the Be Informed sessions are a capacity building program from Hep B United. We are a national coalition of other coalitions. We're focused on bringing together organizations that are doing work around hepatitis B in their jurisdictions. That could be specifically focusing on hepatitis B or potentially specifically focusing on their community's health and realizing that hepatitis B is one of several health priorities. We have been around since 2012 and are currently funded through a CDC cooperative agreement that I certainly hope continues. This says 50 plus coalitions, but we are now at 60 plus coalitions. We just kind of moved over that number, and we're in now 38 cities and 28 states plus DC. We just got a new member in the last week. So the mission for Hep B United, though, is to reduce the health disparities associated with hepatitis B, and we're specifically focusing on raising awareness, screening, vaccination, and linkage to care in those high-risk communities across the US. So this session, V-Inform session, is something that started nearly 2 years ago. It's held every other month on the third Tuesday, except for today, and they are about 45 minutes long. This actually stemmed from something that Dr. Freeland used to do, or does, sorry. Dr. Freeland is in charge of our ECHO program at the foundation, and several years ago, even before I came on board, there was an idea around creating an echo style format for non-providers. So folks that are more public health focused, maybe community health work, that just takes that same didactic approach of an echo model, as well as the case study aspect to it. And instead of it being a patient, it's something more specific topic wise. Today, we are, oh, well, here's today's schedule. We just are in that first 5 minutes. We'll turn it over to Dr. Freeland here in a minute, and then we'll go from there to Dr. Jang. And from that, we'll have Q&A and open discussion. We normally go into, so sorry, my neighbor's doing remodeling, and occasionally I hear it behind me, and if that picks up, that's what's happening, but I'll about to be quiet, so it's okay. Today, though, while we usually go deep dive onto sometimes esoteric topics, today we're actually kind of going back to our basics, which is really going into some of the best practices of organizing screening events, screening and vaccine events. So Dr. Freeland is my colleague here at the foundation, has been doing some fantastic work on this topic, both here domestically and in other countries, and has been a long time uh, staff person at the foundation and really leads our public health work. And then Dr. Jang's our a partner of ours at the coalition. MAHA has been a member, and they're based out of Chicago, and has been a member for quite a few years now. And they do vaccine and screening work on the ground as well. So that is today's topic. And just to remind you all now, and I will ensure to remind you again at the end of this and drop in the link, but our next session is May 20th at 3, and we'll get that link into the chat momentarily. But I will now happily be quiet and turn it over to my colleague, Dr. Freeland. Catherine, take it away, please.
All right, I just requested to share my screen. There we go. Perfect. Thanks so much, Frank, for the invitation to be here. I'm just going to make sure that it goes to, there we go. All right. So I am really excited to be here with you today to speak a bit about hepatitis B screening. Some of this will probably be very familiar to many of you, but some of it hopefully will be some new information and insights based on the work that I've been doing in the Philadelphia region, and also some global perspective that I'm happy to talk a little bit about as well. But much of this work is community-based work, and so that is the perspective that I'll be bringing into today's discussion. But this is just a high-level overview of what I'll be covering today. So I'll be starting with linkage to care and the importance of really working initially to secure that prior to really developing a community-based screening program. And then we'll go into working with trusted community partners, followed by the logistics of screening. It can be kind of overwhelming, especially when you're first getting started. Lots of folks at play here with scheduling screenings. What does the day look like? What do the logistics look like of that? And specific activities and staffing considerations that you might need to take into account. And then really importantly, the circling back and that linkage to care and results and labs. What do you do with all of that information that you're receiving in from the lab? And then concluding with data collection and analysis. And hopefully some of this will be helpful. But the first point that I think is really essential is the establishment of linkage to care sites. And what do I mean by this? Kind of being mindful of who you want to screen is really important, and what their needs might look like down the line. So if you're finding somebody that might be positive with hepatitis B, what services might those individuals need in terms of healthcare? I will say from our experiences in Philadelphia, many of the folks that we're seeing may not have access to healthcare, a regular provider, or insurance. And so you need to be mindful of making sure you're able to meet the needs of those people if you're going to be screening them. And what I mean by that is finding a provider that can manage their hepatitis B. And so what we do in Philly is work with a lot of our federally qualified health centers. I will say this is one of the hardest parts, is to really get those connections with folks in those FQHCs to try to make sure that you're developing relationships with them. Not only that, but also making sure that you have a segue in. Sometimes in Philly, particularly, I know in other jurisdictions as well, there can be long waiting times for getting into an FQHC, which can be very burdensome for someone and also kind of stressful, especially if they've just gotten a diagnosis that they may not really understand about. So if you can kind of speed their referral process and make those connections with the FQHCs to make that possible, that's a really big win for the communities that you're serving. The FQHCs that we have in Philadelphia do serve on a sliding scale, and some do not charge people for the care and services that they receive. But to get into an appointment for a hepatitis B positive test, you do have to go through primary care as well. So it will be an overall primary care. So it's really important, I think, to make sure that you're working to set those relationships up and set those initial providers that you can send people to. Ideally, if you have providers that speak multiple languages and are used to seeing folks that may not prefer to speak English, that is really helpful as well. Also being mindful of, if you're in a big city like we are, trying to have providers in different regional locations throughout your city is really helpful. So you can try to find something that's really close to the person in their local address, for example. Other spaces is specialist care. Do you have some providers within your network or folks that you've worked with over the past that can help you if you need a referral? So sometimes the FQHCs may need to refer out for a more complicated case. Also, establishing those relationships and helping facilitate those relationships can be really helpful. A lot of our academic medical institutions can also see folks through pro bono care, and they're willing to do that through our screening programs. And so that's something to also be mindful of. There's also charity care, which you can help apply for a particular individual if that's necessary as well. But really, the provider is really important, because not only the provider, but they may need to be your standing order provider for your lab test results as well. We have a provider that's on our medical advisory board that serves as our standing order provider for all of our labs that go out through Quest. And so her ID is what we use to order all of our labs through Quest. And I'll get into that a little bit later, but it's really important that you kind of maintain those relationships with your physicians. Oftentimes they're really eager to get involved with things like this and support these activities. Some even come out to the screenings with us and support us in that. So then the next aspect that I think is really important to start off with is identifying your community partners. This includes folks that have really strong, trusted relationships in the communities that you think may need or benefit from hepatitis B testing. This could be a local church, for example. This could be refugee resettlement organizations, shelters, syringe exchange sites, community centers. We work with a lot of resettlement organizations, but we also work with a lot of social service organizations in Philly who see folks that are often coming in through immigration or things like that. And so they may need services, and they may need first engagement with healthcare, and we're trying to support them in that. And making sure that those groups, oftentimes they do have a really strong, trusted relationship in the community, and the community does feel comfortable going to them, which makes it easier for asking for a blood test, which is ultimately what you have to do with a hepatitis B screen. So that's really important to consider as well. And I will say it takes a lot of time to develop these relationships, and it's also an active engagement with partners, but oftentimes they're looking to provide these services for their communities through health fairs, things like that. And so it's just important that when they're ready to use your services, you can be there to provide and support as they need it. In terms of scheduling screenings, the next step is really, after you have your standing order for your lab form and you've identified a lab that you're going to use. The most common commercial labs are either Quest or LabCorp in the US. We use Quest. We have a discounted rate through them. We have a regional representative that we reach out to negotiate and tell them kind of roughly how many people we're expecting to screen that year. And they often give us discounted rates for helping to support those activities. And we also tell them the populations that we're targeting as well, so they know really that these folks could benefit from screening and also don't have access to insurance and things like that. So when we're working as well, we have to find a phlebotomist. It's taken a lot of time, and we've worked with a lot of different companies to find some that really work well for us. I think they can also be very costly, so it's important to kind of shop around and find what works best for you when you're doing this process. But we've found some that work really great for us, and they contract out with us and attend all of our events. And it's important to note that many of these events take place on the weekends or evenings, being mindful of that's when the community is needing or requesting these services. And so we're being flexible to make sure that we're able to offer these opportunities when our community is requesting it. And also these are located oftentimes at our partner sites or community spaces where people feel comfortable going to. And so really being mindful of that is important as well. When you're looking for staffing, we found that a lot of our Asian Pacific American Medical Student Association student or any medical students that we're working with, like an infectious disease group, for example, there's a lot of student-based organizations within medical schools that are really eager to get out into the community and to help. And so we pull these folks in to come not only to do training for them as a part of their medical education, but we also bring them in with us to do screenings and participate with us in this. I will also say that translation is really important if you're able to have in-house translation capabilities so you can really communicate with the folks that you're trying to reach. That's really important. But if you can also bring in volunteers that have multilingual capabilities, that also really helps. It also makes people feel more comfortable participating in a blood test, which is often something that people may or may not feel comfortable doing. And again, partners also can help with some of these translation services if there's a really unique language that you may not be able to have in-house, or you may not be able to have a volunteer to support in. Sometimes the partners can step in and help you with those things, but that's just some kind of open communication that needs to take place between you and the partner location to make sure we're able to fully meet the needs of the communities. And prior to going to an event, we always ask our partners which language they're expecting from the population that we'll be screening in. So we can make sure, we have materials, and also so we have translators available on site to help support the day of. Some of the materials that we bring to our event for us, we bring our own test tubes and our own screening biohazard bags. We also bring personal protective equipment to make sure that folks feel comfortable if they want to wear masks, and make sure that we also have sanitizer and things like that. Just given the COVID situation, we want to make sure we're protecting ourselves in the communities that we're serving in. We have screening forms, fact sheets and flyers. We have an informed consent and a demographic form. Our informed consent and demographics are all on a tablet that we bring in. And then we have our Quest lab forms, which we require a couple of different forms of just contact. This is just required from the lab. So, and also just required for us to make sure we're able to communicate with the individual, particularly after the test, making sure they get their test results. We request the address and the phone number. Sometimes this isn't possible. We've been particularly seeing a lot of folks who have been recently seeking asylum. And so they have sometimes a more nomadic lifestyle. And so making sure we're trying to accommodate their needs, working with the partner organization to make sure linkage to care is possible. Another thing to think about is the partners that you might be working with. Sometimes the Philadelphia Department of Public Health can come on site, and they've been willing to provide vaccinations in the past. So what we do is we look through our screenings to see, have we tested in this space before? And if we have people who might need vaccination from a previous event, we'll invite them to come back for free vaccinations from the health department. Or we'll also consider doing test and vaccinate on the same day, but you have to just make sure the testing takes place before the vaccination if you do want to do that. I think it's really important to kind of show you what some of our testing looks like. A main message is being flexible. We can be outside or inside. Really, we just need an outlet for our centrifuge. Obviously, shade is really helpful too if it's a warmer day, but really being flexible and trying to meet the community where their needs are, I think, is really essential for the process. We've also been stuck in basements where there's low light. Asking these questions of your partner so you can be prepared is really important. If you know you're going to be in a place where the lighting might not be great, it would be helpful to bring like an extra lamp for your phlebotomist, as that is going to be an essential thing for them and their success for the day. So linkage to care. Obviously, it takes some examining and interpretation of lab results after this. And then with that, we have a letter and a copy of the lab results that are sent in the mail to any participant. And with the linkage to care, we follow up usually by phone, particularly if somebody is positive, being mindful that you have to be careful what information you share. Usually we say, hey, just checking, I'm from the Hep B Foundation. Did you get your letter in the mail? And if they say yes, okay, great. Do you have any questions? Can we chat? And then we'll follow up that way. So to make sure we're not sharing any sort of information that might be just trying to be HIPAA compliant in that regard. Though I will say texting has been really helpful. Just be cautious when you are texting. People feel more comfortable responding sometimes to a number that they don't recognize compared to picking up a phone, because there's just been so many spam calls recently. So that's something important to note that we've observed. This is just a friendly table that shows what to do based on test results. Anybody positive, we work with them to make sure if they have a doctor, connect with their doctor. If they don't, work with them based on their specific situation. If they have insurance, if they don't, where they're located in the city, what languages they speak. And based on all of those factors, we'll work to link them to care that's most appropriate for them. We'll also look at core positive. We do a triple panel screen. With our screening, we used to only do surface antigen and surface antibody, but we've added in the core now. And this is really important because we've particularly found a lot of core in the community, and making sure folks are aware of their core status is really important. So we try to do our best to make sure people are educated about what the test results mean, make sure they really understand them and can take action and share the results with their provider. So the action steps, linkage to vaccination, if possible. I think this is one of the hardest challenges, particularly for people who are uninsured, but something that we're continuously working to improve upon. Linkage to care for people who are positive. More testing is definitely required for these folks. And then also making sure they really understand what their tests mean and what it means for monitoring of hepatitis B and the management as well as reactivation. Core positive seems to be prevalent in particular communities, so it's important to make sure they understand the risk of reactivation in these situations and when that might be something to be mindful of. But definitely making sure everybody understands the importance of sharing their test results with their provider. In terms of our order forms and what they look like, we have a consent form. We make sure that people understand what they're agreeing to participate in. We don't pressure anybody to participate. It's completely voluntary. We also make sure people understand that they can remove their participation from this at any point during the process. We also have a demographic, behavior, and lifestyle question that we ask people. Specifically looking at their date of birth, educational background, health insurance. Do they have a doctor? Have they seen the doctor in the past month? This helps us with the linkage to care process. We look at country of origin, as this is really important for our epidemiology and looking at risk factors, drug use, as well as any other history of hepatitis B testing, as well as sexual risk. One thing I will say, I think this is one of my last slides, but your data is really important. As somebody in the community, you see a different group than someone who might be working in a clinical setting where research is maybe done more prevalently. So it's really important to think about what you can do with your data and how you can use this information in a way that's ethical and also helpful to public health practice. This data can help us understand gaps in hepatitis B and where hepatitis B is prevalent, and identify areas for prioritization and allocate resources where we identify need. With our data, things that we've done in the past is we work with students to help us do analysis, for example, and put those for poster presentations or abstract submissions to different conferences, both locally and nationally. And then we also work on submitting manuscripts to fill in some of these data gaps that are really common for hepatitis B in some of the communities that we're serving in. But I'm happy to take any questions or if there are any comments. I think that was the last slide. Thank you.
Thank you, Catherine. We are now going to shift from here to our case study speaker, Dr. Zhang. Shreya, are you sharing on your, yep, there we go. Shreya's always on top of it. Okay, I can see it. Let's just get that to full screen. All right, sounds good. And then, yeah, we'll turn it over to Dr. Zhang. And folks, please put in any of the questions you may have into the Q&A box, and we'll get to those after we're done hearing from our case study. So I am excited to introduce Dr. Zhang, the Director of Community Health Programs at for the Midwest Asian Health Association. So sorry, this other MAHA acronym just threw me off for a second. You guys are the OG MAHA, and the only one I really want to think of when I hear the term. So I'll turn it over to you, Dr. Zhang.
Thank you, Frank. Hi, everybody. Have a good afternoon. I was invited to talk about community outreach and education. Since Catherine, Dr. The previous presenter already talked about the screening and next slide. Can you Shreya? Yeah. This is Maha. The picture of this building is our main office. We have another office where we started right in the center of Chinatown in Chicago. Organization started in 2003. The Hep B program started 2012. That's the first program as only at that time, hepatitis program in Chinatown area. We provide screening, testing, vaccination, and linkage to care. After screening, once a month we provide a screening on one of the weekend, Saturday morning, and 2 weeks later, well, when the result come in, we start to call clients. The clients who test negative and no immunity to Hep B, we invite them for the vaccination. We partner with UI Health, University of Illinois Chicago, Quest for the lab, and also we partner with the Chicago Health Department for the immunization. For care, we have a doctor from Northwestern University who do once a month virtual clinic for the positive clients, prescribe the testing, medication to monitor their progress. And our staff also assist the clients, low-income clients, to enroll in drug assistance program so that they can manage their symptoms. This is our mission. Next slide. As far as outreach, education concerns, we have been taking several strategies. The first one is we build partnership with all sorts of stakeholders, including CBOs. They are also like MAHA. They have been providers in the community. They build a trusted relationship with the residents in the neighborhoods. And also healthcare providers. That's why we will have people who come in to volunteer their time and resources to provide a screening and the vaccination and the linkage to care. Even linkage to care, we have doctors from Northwestern University, liver specialists to provide treatment and care. So it's very important to always find who can be partner, benefit from each other's service. Um, and the second strategy we took is like we use a community health worker model, or we also call it a lay health worker model. Those are, we have a couple of employees in the program who have been with the program for a long time, ever since we started the program. They are not necessarily experts in Hep B to start with, but over time they really gain a lot of expertise. More importantly, they really connect the community very well. They build rapport with the residents and can answer all sorts of questions. They're very important messengers for our care services. They relate to the community really well. We felt like our program benefit from our health workers. And the word of mouth, it's very important when you provide services. You make sure you always deliver, and you provide good quality services. You answer all the questions. And when clients receive good service, quality services, they will. We are such like a very close community, close-knit community. Residents pass words onto each other, say, hey, Maha provide this service. No, it's free. It's really good. They have other things. So it's just now we get a lot of clients from referral among themselves and also from the partner agencies because they connect to the clients well. When we really honor those services through referral from the partners, and they will spread words for the program. So we always make sure we really provide good service and quality care to our clients, so people will help you spread words, and then this is a trusted relationship you build in your community among your clients. And next one is internal referral, and I for organizations provide multiple services like Maha. We have like a CARFA credit mental health employment program, family advocacy center funded by DCFS, all sorts of programs, and navigator insurance program. So those are very important. You make sure the program knows your screening activities, give them flyers, and also you provide mutual referral, cross referral from each other. Like we have clients who tested positive. If they don't have insurance, then we refer to our Navigator program. That's a health insurance program, benefit enrollment program. So they can find if the client's eligible for the insurance, access to medication, make sure the insurance company really provide kind of medication to them. So this can also become word of mouth too, because you really benefit from your internal services. So don't forget your own service that can help you outreach to other clients for the screening and vaccination. And also because we're in Chinatown, and even with outreaches now, we reach out to DuPage County, Kane, and Lake. People in Illinois might know they are in the West. They're not even in Cook County. Chicago is part of Cook County. They're a different county. Now we outreach them. Our core population still limited English speaking. So we always make sure all the materials translated, and we hire bilingual staff. That's the best way to communicate with clients efficiently and directly. Can explain the services and explain their results. That's important. On the left side are some of the translated materials and our outreach recruitment materials. The approach mainly we took so our community education outreach. We do one-on-one education to the clients, the residents in the community. If we do the tabling events in the library, our small group education in the church, we also just pass out information through community outreach. What some of the sites we reached out include community-based organizations. They're our partners. They have services that MAHA do not provide. No matter how hard you try to provide one-stop service organization, some services still cannot provide, like ESL legal services. We refer them out, but you build a partnership. They can help you to outreach. We attend the community meetings, events. We go to school, back to school events in fall. There are a lot of them. You can reach to the families, daycares, libraries. Build partnership with local libraries are really good. They always invite you if they have a set up a table. They have events with other organizations. You can join them to set up a table for the pantries, churches, business, stores, and streets. We sometimes post our flyers on the street, so people pass by, like train station, um, so people will see, make that no, um, like a available to the community. Any place is convenient, and the visit, they will see those information. Next slide, please. So we do social media and ethnic media outreach. For instance, WeChat, Facebook, Instagram, website listserv. If you go to MAHA's website, you will see events calendar. You will see Happy Bee events there, list every month. That's English, of course, but WeChat is a lot of Chinese are using WeChat. Maha has thousands of followers on WeChat. Then you create different groups. The media, the Chinese newspaper are also in those groups. When you post a calendar, when you make a public announcement, they will repost for you to like a snowballing. It goes to other groups and spread words for you. So that we find it's very effective. Our social media specialist created like a community calendar, all the events calendar, not necessarily all MAHA, but include MAHA, posted in the WeChat periodically. Our staff also post the events there. The picture, the photo on the right, the first one you can see, this is annually we do Asian Heritage Month in May. And also health fair. We set up tables to present our programs for the resident participants to pick up information. They go to different booths and then we give them a little gift. This board here is created by an intern in front of the table. That's an education project board. We always use simple language translated information to present to our community, make sure they understand. The picture on the right, also people line up for the screening and vaccination events. We feel like registration is very important. When you post out all the informations, we use QR code or provide registration information. They register ahead of time. And then you have an idea how many people will come. And our community health worker will remind them on that day in the morning, the screening day. So the outreach always relate, recruitment always relate to the care that you are going to provide. We remind them by calling them, and also we take walk-in patients because not everybody will, register in this community. It's okay if they come in. The next thing we feel very important is to create integrated service. If you only say we do a screening for Hep B, people may not all benefit from them, the event. If you provide other possible event, like you invite university students, dental care, they provide the dental information, also do the blood pressure testing, osteoporosis, so they can do like other services. And when you provide vaccination, the city health department will bring fresh market in summertime, and the Blue Cross Blue Shield will bring sanitation, like hand sanitizer, pens, giveaways. Those are really helpful, can help to attract participants. That's it. I think that's the end of the presentation. You can go to next slide. That's for questions. This is the gate, Chinatown in Chicago. I just want you to see how it looks. Next slide is contact information. You can just let everybody see. So that's me, and also my colleague Jennifer Song, the program coordinator. I'm pretty sure she is in the meeting too today. And this is our website. Just in case you're interested, you can take a look. Thank you.
Thank you. And I did share the link to your website in our chat. We do have a couple of questions, so I do want to just dive right in. So I believe this one was, this is 20 after, so this would be for Catherine. Richard would like to know more about the tablet and how you manage the info.
Yeah, sure. So we have a subscription data collection tool called Open Data Kit, or ODK. It's used you don't have to have internet connection to use it. And so we bought some reasonably priced Samsung tablets that were less than $100. And we had a grant at the time, and we're using it to kind of help launch this, us going paperless. So we have our informed consent as well as our demographic form on there, and everything automatically, once the tablet is connected to Wi-Fi, goes into a cloud stored database online. Everything is HIPAA compliant, and you can use these from mobile devices or a tablet if you have them. And it's a great resource for keeping our data organized. I don't remember off the top how much the subscription is, but I don't think it's a ton. It's maybe about around 1,000 a year or something like that, or just over that. It depends on how many surveys you have as well.
All right, we have another question. This one's for Dr. Zhang. How are you able to be successful using WeChat and combating misinformation on it?
Yeah, I think that there are other organizations to combat misinformation in Chinatown community. One of our partners, that the organization is a coalition of building better Chinese communities, Chinese American communities. They're doing the civil engagement, doing more. We always provide accurate information to the client. Hep B, of course, we to because I said in our chat, like group chat, also have news like several Chinese newspaper in the group. They will help us to provide. If you do not provide accurate information, the community will consume the misinformation. So you make sure you get accurate information to the community. It can be hard. This is not Hep B, it's more obvious, but during COVID, it's a really hard battle, whether they need vaccination, no, whether vaccine effective. So you have to get your information, correct information to the community. That's very important. So you rally with the media. They help you to spread the word. If you post something in the group, they will repost in their newspaper. That's a really great thing to do. And you have an event, you made a public announcement, they made an announcement in their paper. That newspaper will spread to the broader audience than you can reach. And you have to think of outreach strategically for the like Facebook, how you link to their partners, you cross sharing information, accurate information. So that's how you deal with misinformation.
We have a couple more questions, and just field them quickly. This is for Catherine. Do local clinics in Philadelphia usually follow guidelines for Delta testing and liver cancer surveillance?
That's a really good question. I think Delta testing has been difficult to incorporate into a primary care facility based on, luckily, the Philadelphia Department of Public Health has been really good at surveillance. They actually just released a recent report that included Delta for the first time, which was really encouraging. And for kind of what you would expect, the Delta testing is happening at the specialty clinic, not at the primary care level. More training is definitely needed to encourage greater uptake of Delta testing. I think this is something that's really just kind of emerging in terms of prioritization at different spaces. So it's something that we're working on through our ECHO program. And then liver cancer surveillance for both hepatitis B and Delta, I think also could certainly be improved. I think from the Philadelphia data, there's also a lot of loss to follow-up due to a variety of barriers among populations that have hepatitis B. And so this is something that we're also working to kind of address and figure out where are these gaps and how can we do a better job addressing them. But there's a lot of work to be done. And I think we're going to continue to work with our providers and educate them to do best practice and follow those guidelines.
Thank you so much. We have another one for Dr. Jiang. When you have a patient that tests positive for surface antigen, do you have a specific clinic with expertise in Hep B that you refer them to in terms of a pathway to treatment?
Yeah, we do have a Hep B clinic, which is run by a specialist, a liver specialist, who used to be in University of Illinois, Chicago, and now he is in Northwestern University. We have another liver specialist join him. This is Dr. Chen. She is in University of Illinois. So they run monthly Hep B clinic with our patient. As soon as our patient tests positive, we will refer the patient to those doctors. They run monthly Hep B clinic. Our staff provide translation for the doctors, and doctor will provide medication, provide further testing, monitor the changes. Of course, our staff really bilingual staff really helpful to follow up make sure the clients will go for those testing. Will make sure they get the medication from local drugstore. I thank you so much for asking this question. That's because I feel like some of the clients they like they do not have sufficient language skills, or they don't have proper transportation. It's very hard for them to go diagnostic care. Some going going to a different neighborhood, going to other provider. We do have a contract agreement with those provider to have discount rate for our local income patients, but you really need to really provide hands-on help to tell them where the provider is. You need to make appointment. Sometimes like wife who are positive, but they need a husband to take a day off to drive them to the clinic to get tested. Um, uh, Sometimes they got lost and you have to answer the phone call to find the map to guide them to the clinic, the site. So yeah, we do have a provider who have been a longtime partner to provide this services for free. So that's why at my early time, the outreach, we said the building partnership is very important. That's not only for the outreach, also for the care. That's part of it. Thank you. That's
Awesome.
a
Thank
good
you.
question.
Yeah, and we have just one more, and then we'll be wrapped up. This is for Dr. Freeland. You mentioned that the phlebotomy and then follow up to what you find with the phlebotomy to when you put in your tests were big barriers. How would like a rapid test or a point of care test or like a finger prick test change the dynamic with those barriers?
I think, I mean, I think you're still dealing with blood, but I think that having a rapid test would reduce the cost likely of, because phlebotomy is quite an expensive cost that we have to allocate for. I think it would maybe make testing more approachable. It would make linkage to care easier to do because you could theoretically do that right after or soon after, 20 minutes after a test, as I would kind of imagine it would be similar to a hepatitis B test or an HIV rapid test. So that would be really helpful. So then you could sit with a person while they're there and explain what that means to them. I think, it certainly would be an adjustment from what we're doing now, but I think it may make things more approachable, definitely more cost effective. And it will probably make it easier to screen more people in a faster amount of time.
I don't know how I accidentally muted myself. So certainly would have some good possibilities if we were to have a rapid test or more easily accessible like finger prick tests. Great. Well, I appreciate everyone taking the time today. I'll wrap up here because we usually wrap up about 45 minutes after, but this was such a great conversation. I did not want to cut it short. Thank you very much to both of our speakers, Drs. Freeland and Yang. Please feel free to look at the Foundation's website at hepb.org, our coalition website at hepbunited.org, or MAHA's website, which is maha-us.org. Yeah, I remembered. Yes, that's right. All three websites are a wealth of information and have quite a few resources. Like I said, we'll get the recording from today posted on our website by middle of the day tomorrow. And if you're subscribed to our newsletter, we'll be sending a link out in that tomorrow as well. Lastly, here is the link to register for our next Thank you, Shreya. The link is in the chat. Please do register. It is on our health equity tool. This has been a tool that our health equity working group has spent several years developing. So we'll have the leader of that group, Chioma Naji, excuse me, Shimanaji will be joining us in May, on May 20th. We'll be going through the creation of that tool and how it's used. So thank you again. Appreciate all the great information from our speakers and the engagement from our audience. And we hope to see you later next month. Bye, everyone.
Thank you.
Thank you.
Bye.